Hello and welcome to your favorite program on Clearview Television, You and Your Health. The only program that gives you the privilege of knowing about your health and how to take care of you. My name is Rose Audu, your host as usual. And with me today in the studio is Dr. Adakole F. Okoh. He is a medical advisor. You help me to complete the tuberculosis missions to Nigeria.
Yes, I work with the Leprosy Missions Nigeria.
Okay.
Yes.
It's good to have you on the program today.
It's a pleasure to be here with
And
you.
then it's not a coincidence. Today we'll be talking about TB, tuberculosis. Tuberculosis these days is becoming a serious health challenge in our society, in Africa, and even in Nigeria. And a lot of persons, might have it and not know that they are also infected with these disease. Hence, the need we talk about it and how to tackle this issue in Nigeria. And today, my first question will be, what is tuberculosis? I would want us to know at least what we are talking about. Why are we doing this? What is tuberculosis?
Okay, thank you. Tuberculosis is an airborne infectious disease that is contracted by an individual who is in close contact with a tuberculosis case. That is somebody that has the disease. So that is how it's gotten. It's airborne. And it's a very big problem now in the world. There's a difference between tuberculosis infection and tuberculosis disease. About a third of the world population is infected with the tuberculosis infection. However, it doesn't mean that anybody that has the infection automatically has the disease. So it's of very great public health importance, and the burden is quite high. About 10 million cases of tuberculosis, new infections of tuberculosis, were reported at the end of 2017 globally by the World Health Organization. So it's really a problem, and it has killed more people than HIV in the last 3 years or thereabout. So it is now considered the single most important infectious disease killer in the world now. Yes, and Nigeria is a high burden country for tuberculosis.
All right, so can we say tuberculosis is hereditary?
No, tuberculosis is not hereditary. Because when you say a disease is hereditary, it means that you can get it, by genetic transmission. So it is an acquired disease. And like I said earlier on, somebody who has tuberculosis, what we call infectious tuberculosis, if that person is in close contact with another individual for quite a reasonable period of time, that other individual stands a risk of getting infected with the tuberculosis. Yes.
All right, so what are the common symptoms of TB?
Okay. The commonest symptom of tuberculosis is cough that is at least of 2 weeks duration or more, what we'll call prolonged cough. And we find a lot of people who have cough and they take a lot of medications and it gets protracted, the cough still persists, and they take a lot of cough syrup, sometimes Septrin tablets from chemists, and the like. Those kind of individuals need to be screened for tuberculosis because they might as well have contracted tuberculosis. So cough is a cardinal symptom of tuberculosis. The other symptoms as well, the person can have a fever, the person can have weight loss because the disease is also associated with weight loss. There can be malaise, which is feeling of unwell, So those are common systemic symptoms of tuberculosis. There can also be other symptoms based on the part of the body or the organ system of the body that the tuberculosis affects. But commonly, those are the symptoms because what we call pulmonary tuberculosis, or tuberculosis that affects the lung, is the commonest form of tuberculosis.
Hence, there is a need for an individual to do a checkup when you discover you're losing weight unnecessarily,
Yes.
and then you have a persistent cough for 2 weeks and so on.
Yes.
Okay, so what are the types of tuberculosis, if there are any?
Yes, you can actually classify tuberculosis in a couple of ways. You can classify tuberculosis based on the organ system that it affects. The commonest form is pulmonary tuberculosis, or what we call the tuberculosis that affects the lungs, and then the tuberculosis that affects other parts of the body. So we have pulmonary tuberculosis, tuberculosis that affects the lungs, and what we call extrapulmonary tuberculosis, tuberculosis that affects other parts of the body. The one of greater public health importance is the pulmonary tuberculosis, because that is the one that commonly produces cough. That is the one that somebody who has it can infect others who are at close proximity to him. Tuberculosis can also be classified based on whether it is drug-susceptible tuberculosis or drug-resistant tuberculosis. Drug-susceptible tuberculosis is a tuberculosis that can be treated with what we call first-line antituberculous medications. But sometimes we have a form called drug-resistant tuberculosis that is resistant, that cannot be treated by the usage of first-line antituberculosis drugs. You now have to use some other drugs called second-line antituberculous drugs. And the interesting thing is that the drug-susceptible tuberculosis is easier to treat compared to the drug-resistant tuberculosis. So more often than not, the drug-susceptible tuberculosis, if it is not properly treated, can progress to become drug-resistant tuberculosis. So that's another way to classify tuberculosis.
So in a situation where a patient discovers that maybe you have a drug-resistant tuberculosis, what do you advise such patients to?
Yeah, usually the drug-resistant tuberculosis is a laboratory diagnosis, which means that for you to say that somebody has drug-resistant tuberculosis, it must be confirmed from the laboratory. And there's a machine that we call the Gene Expert machine, which can test the sputum that is produced by this individual and tell us whether it is drug-susceptible tuberculosis or drug-resistant tuberculosis. And it's important that somebody who is diagnosed with drug-resistant tuberculosis is promptly enrolled for treatment, because it's a more serious form of tuberculosis.
Oh, wow.
Yes.
So how is tuberculosis diagnosed? How is the diagnosis carried out?
Well, basically you can diagnose tuberculosis in two ways: laboratory diagnosis as well as what we call clinical diagnosis. Somebody who presents or in whom we find symptoms and signs of tuberculosis needs to be tested so that it can be confirmed. So usually what is done is that the sputum of the individual is collected and then tested, because the organism that causes tuberculosis is a bacterium. It's called Mycobacterium tuberculosis complex. So the person is tested, that's the sputum of the person is tested, and then the diagnosis is made. There are a few instances where the diagnosis can be made clinically. That is to say that the sputum of the person was not used. But usually is a trained doctor, is a qualified personnel, healthcare personnel, that can make that kind of clinical diagnosis. But by and large, we try to make the diagnosis by testing the sputum of the individual. So those are the two main ways.
All right.
Yes.
Taking you back a little to the types of tuberculosis, can you say that there are types of tuberculosis that are triggered by certain medications?
Well, there are risk factors for tuberculosis, and the strongest risk factor for tuberculosis now that is known is HIV infection. is a very strong risk factor for tuberculosis because HIV decreases the immunity. And tuberculosis is what we can call an opportunistic infection. Usually emanates or gets established when there is something that is suppressing the immune system. Now, there are also other conditions. Diabetes can also decrease somebody's immunity and make the person susceptible to develop tuberculosis. And then cancers, which also decrease the immunity. And then talking of the medications, answering your questions now, there are some medications that are called immunosuppressive medications that are used to treat certain conditions. And such medications, as part of their complications or side effect, can decrease the immunity and make the person susceptible to tuberculosis. But by and large, the commonest risk factor is HIV infection. There are other risk factors as well, but that is the most important risk factor. Yes.
So what are the major modes of TB transmissions?
Okay, like I said before, it's airborne. And then before I answer that, another drug too that can predispose somebody to developing tuberculosis are steroids. A lot of people consume prednisolone, dexamethasone, and so on. So prolonged ingestion of steroids for a long period of time can predispose you. Now, talking about how tuberculosis is contracted, I said earlier on that it's an airborne disease. So it's a droplet infection. That is to say that the person who has tuberculosis infection spreads the disease when he coughs or when he sneezes, or even when he laughs, or even when he talks. In fact, he releases the tubercobacilli. And so somebody who is in close proximity to that individual inhales these tubercobacilli. And with time, that person can actually come down with tuberculosis. Another thing that I also need to mention, I mentioned the fact that there are risk factors for tuberculosis. Most of us are infected with tuberculosis, but we don't have the disease because we are in an environment that is endemic, that is where tuberculosis is prevalent. And so a lot of us have what we call latent tuberculosis. It's a subclinical infection. You have it, you don't have the disease, you are moving around, you are strong. But so if something now affects you that depresses your immunity, as it were, then the tuberculosis now becomes an established disease. And then you can say the person has tuberculosis as a disease. So that's why it's very important. And usually somebody who has tuberculosis, we screen for HIV, like I said, is the strongest risk factor amongst other risk factors that we have. Yes.
All right. Let me ask, like me on this end, and then for the sake of people who are watching out there, can tuberculosis be treated? And if it can be treated, what are the best medication for TB treatment?
Okay. Yes, the good news about tuberculosis is that it's a very treatable disease. Somebody can be treated and in fact be cured of the disease. And the interesting thing, and also another good news, is that the drugs are free. They've been made free by the National Tuberculosis and Leprosy Control Program, which is a department, under the Ministry of Health. So the drugs are free, and somebody who is tested and diagnosed for tuberculosis can take these drugs for some months and be cured. So the good news is that it is a very treatable disease.
All right, before we continue, we'll just go on this short break, and when we return, you and your health continues, so stay with us. Welcome back, and this is You and Your Health, in case you're just joining us. And we'll be talking about tuberculosis and how these infection or disease, whatever we may call it, how it can be treated and how it can be prevented. And someone who is doing justice to that is no other person but Dr. F. Adakole Okoh, who is still with me here in the studio. Then my next question will be, how deadly is a tuberculosis?
Okay, like I said, tuberculosis has become the most important infectious disease killer, in the world now. And in the last 2-3 years has killed more people than HIV. The good news, however, is that it is a treatable disease. So somebody who is diagnosed on time can be treated. Usually the treatment is for a period of 6 months. The pulmonary tuberculosis is treated for 6 months, at the end of which the outcome for treatment is usually very good. So if you treat 10 people who have been diagnosed with tuberculosis, you can be sure, that 9 out of the 10 of them will be cured. The outcome is usually that very good. So it is a disease that is treatable. That's the good news. However, if somebody has tuberculosis and it is not diagnosed on time, it can lead to complications. And so most of the deaths from tuberculosis arises from the complication of the disease. For instance, an individual who has tuberculosis, one of the commonest symptoms, like we've talked about, is cough. And this cough can be productive of sputum. After some time, the person may realize that there is blood in the sputum, what we call hemoptysis. That is a sign of complication already. Sometimes the disease can spread to other parts of the body, what we call disseminated tuberculosis. Sometimes it can spread to the central nervous system, cause tuberculous meningitis, that can present like other bacterial meningitis, So the complication of the disease is usually what kills. So, but if the person is diagnosed on time and treated, it reduces the mortality or the death that this disease can cause. Yes.
Well, can tuberculosis be prevented? And if the answer is yes, how? And if no, why?
Yeah, it can be prevented. In fact, it is. There's a saying that prevention is not only better than cure; it is also cheaper. In our environment here, when a child is born, for instance, the child has a vaccination called BCG, vaccination at birth. I think most of us here, had that vaccination at birth. It doesn't prevent the development of tuberculosis 100%, but it prevents severe tuberculosis infection. So that's one of the preventive measures that is instituted even at birth. And then avoiding having proper etiquettes, health etiquette. For instance, somebody who has protracted cough, you're in that environment, is good for yourself to screen yourself, to protect yourself from that kind of environment. So protecting yourself from an environment where somebody who we call a presumptive TB case is coughing and expelling the bacilli by covering, maybe covering your nostrils with handkerchief, avoiding that environment. Those are protective measures. So general health education measures, universal precaution. Again, too, when the individual who has tuberculosis is diagnosed and treated, in fact, that is the most potent way of prevention, because when the person is treated, he can no longer spread the disease. So the best way to prevent tuberculosis is to actually treat a tuberculosis case that has been diagnosed. Because it is said that studies have shown that an individual who has tuberculosis, who is not detected and not treated, at the end of 1 year, can spread the disease to like 10 or 15 people. Yes. So by treating the person who has tuberculosis, you've already prevented 10 to 15 people developing tuberculosis at the end of the year. Yes.
Right. Are there any particular diet that is advisable for people with TB, or maybe they live a normal life like every other person?
Yeah, one of the risk factors for tuberculosis, amongst other things, is also malnutrition. So for instance, children who are malnourished or some other disease conditions that are associated with malnutrition can predispose somebody to developing tuberculosis. However, there is no special diet. The person can eat what we call a balanced diet, eating carbohydrate, protein, fats, minerals in their correct proportion. So there is no specific diet, but a balanced diet, it's a diet that is advisable for those who have tuberculosis.
All right. So who can you say is at risk? Who is at risk of contracting tuberculosis?
Okay. If you are in contact with somebody who has infectious tuberculosis, when I say infectious tuberculosis, I mean tuberculosis that has been established as a disease in an individual and is pulmonary, the person is coughing out the bacilli or is sneezing them. If you are in contact with such a person for a prolonged period of time, you stand the risk of developing tuberculosis. Now, overcrowding also is also a risk factor, and this brings to bear poor housing. So overcrowding, poor ventilation, these are all risk factors for developing tuberculosis. HIV infection is a risk factor for developing tuberculosis. Diabetes, cancers, they are all risk factors. Smoking too has been found to be a risk factor for tuberculosis because it damages the respiratory tract. And the respiratory tract plays some defensive mechanism against developing respiratory diseases, infectious respiratory diseases. So it's also a risk factor. If somebody is on immunosuppressive medications, is on steroids, these are all risk factors for developing tuberculosis.
So at what point can you say one has contracted tuberculosis?
Yeah, at the point of the person manifesting the signs and symptoms of tuberculosis that I've mentioned, and then the person is tested, diagnosis can be made. And then you can now treat the person. So once the diagnosis is made, you can, and it is confirmed, you can say, yes, the individual has tuberculosis. But usually, the individual would have manifested signs and symptoms of tuberculosis.
All right. Now, according to the WHO report, Nigeria has the lowest TB case detection among high TB burden countries, with an estimated 418,000 cases in 2017. As a medical practitioner, what approach do you suggest is most suitable in finding the missing cases?
Well, unfortunately, the awareness about tuberculosis is not as much as the one for HIV. Most people in remote places know about HIV. The publicity about HIV has been very successful, and we've not gotten to that level of success for tuberculosis. So a lot of people are still not aware about tuberculosis. And so there is the need for vigorous health education campaigns, radio jingles, the media, both the electronic and print media are supposed to disseminate the information that tuberculosis is real and it's prevalent in our country, and that if anybody is coughing and the cough is up to 2 weeks, the person should get tested and not continue to self-medicate. So at important fora in the church, at mosque, at gatherings, in schools, the message about tuberculosis should percolate, it should reach out, to all and sundry. In that way, we'll be able to increase the awareness, and then we'll be able to increase the case detection. Because unfortunately, we are not detecting a lot of our TB cases.
All right, and I'll still go back to saying, as a medical practitioner, and whose primary assignment is to save lives, because I believe you care more about other people's lives than even yours at some point. And can you say that the Nigerian government has done enough in fighting tuberculosis in the country?
Okay, well, the government has been making some effort. For instance, there's been a mandate that all outpatient departments in all hospitals should offer TB services, one form of TB service or the other. That is to say that patients who present in hospitals for any kind of ailment at all, deliberate attempts must be made to screen those individuals for tuberculosis. Because even in the hospitals, tuberculosis cases are being missed by healthcare personnel. So there's that deliberate effort by the Nigerian government. But however, more needs to be done by the government. For instance, the funding for tuberculosis is quite suboptimal. The tuberculosis program is about 76% unfunded. So government needs to do more by providing the funds, to consolidate the structures at the primary healthcare level, and in fact, at all levels of healthcare, so that the services can reach as many people as possible. So as it is now, the program is more or less donor dependent for managing tuberculosis, programmatic management of tuberculosis. So in that regard, the government needs to do more.
All right. Having said all of that, what role do you think, before we go, what role do you think an individual or the organized private sector have to play in this fight against tuberculosis to kick the disease or the infection out of our country?
Yes, another effort that has now come to the fore is that private sectors have now been more aggressively involved to provide TB services. Studies have shown that in Nigeria, about 60% of our patients will first of all patronize a private healthcare setting before going to the public hospitals. It then means that if you want to tackle TB, you must necessarily involve the private sector, private facilities, patent medicine vendors, community pharmacists, even traditional birth attendants. They see a lot of patients, and a lot of them have symptoms and signs of tuberculosis, and they are missed. So they need to be brought on board. They need to be trained. And fortunately, I've been engaged in a program, what we call the PPM grant, Public-Private Mix Grant, where we've been training a lot of healthcare workers in the private sector to offer TB services. So we believe that when they come on board fully, it will contribute to increased TB case detection.
He has given so much revelations, should I say revelations, into tuberculosis and how this infection is eating deep into Nigeria. And if you actually listen to him and the preventive measures and ways of contraction of tuberculosis, I believe definitely we all will be able to stay healthy and stay free of tuberculosis. Well, at this point, we can't go on because there is always this saying that whatever has a beginning, there is always an end to it. And we've come to the end of the show for today. Till I come your way again next week, same time, same station. Please stay healthy and keep watching Clearview Television. You can also remember to subscribe to our YouTube channel, The Clearview TV. Like us on Facebook, The Clearview Television. You can follow us on Twitter at Clearview Online. Follow us on Instagram at Clearview TV_NG. And you can also do us a favor by leaving your comments on all our social media handles. Stay blessed. And you can also sponsor this program. Bye-bye.